Hello.
Hi.
So, for our viewers, please introduce yourself.
I am Dr Sallu Alpha, a medical doctor working for the government of Sierra Leone.
Great. And I'm Dr Utsav Shah, consultant urologist and Uro-Oncologist at Bodyline Hospital, Ahmedabad, India. So, Dr Sallu, you are from which country?
I'm from Sierra Leone,
Oh.
in the western part of Africa.
Wonderful. And what brings you here?
I came here on the referral from my medical doctor, the urologist in Sierra Leone, for a kidney procedure to
Yeah.
remove stones from my left kidney.
Yeah. So, can we go back in time and can you tell us what exactly happened and how were you diagnosed with kidney stones?
Basically, it was just an incidental finding. As medical doctors who are very curious about our health, out of curiosity, I went and do multiple tests, and one of them include an abdominal ultrasound scan.
Yeah.
And the scan showed that I had left kidney stones with hydronephrosis.
So you didn't have any pain?
No pain at all.
And
No
what
pain.
was the size of the stone?
The size of the stone was around 35 millimeters, which is
Yeah.
something like 3.5 centimeters.
So that's a big stone.
Yeah.
Yeah. And then you consulted the department over there,
Yeah.
and what did they suggest?
So the urologist in Sierra Leone, interestingly, we only have one urologist in Konski. He suggested that I had to be referred overseas for treatment because the procedure that is being done in Sierra Leone, which is an open pileotomy, it's
Yeah.
not applicable in my case.
Yes.
So he suggested that I be sent abroad where I will undergo a minimally invasive procedure to remove the stones.
Yes. So after that, can you, for the benefit of our viewers, tell us how we got in touch?
Yes, so as a civil servant working for the government of Sierra Leone, I'm entitled to a medical allowance,
care.
medical care. So I was directed to seek that care
Yeah.
or that help from the government.
Yes.
And when you are seeking help like that from the government, you normally go through the Ministry of Health.
Yeah.
So when I went to the Ministry of Health, I was able to get in touch with the Deputy Minister of Health, and in the Deputy Minister of Health office, whilst we are discussing about my problem, fortunately this young guy walked in by the name of Dr. Emmanuel, who happens to be Ugandan, but he studied in India.
Yeah.
So the Deputy Minister introduced me to Dr. Emmanuel, and said, oh, this guy has a problem like this and he has to be referred. On the point, Emmanuel was so excited to meet with me, and he was very happy to help. In fact, few minutes from our meeting just in the office, he immediately called you, Dr. Utsav, and at that point we immediately spoke on the phone. He asked me a series of questions which I responded to, and that was all how it started. That was all how my journey to India started, and since then we took it from there, and today I'm here.
So great. So at this point I would like to tell that we are very much thankful to the Honorable Minister, the entire Ministry of Health, the Deputy Minister, and especially Dr. Emmanuel for making things work out so that Dr. Sallu Alpha was able to travel all the way from the Republic of Sierra Leone to India for seeking treatment. So Sallu, can you tell us, this is your first time in India, right?
Yes, of course, this is my first time in India.
So for the first time here, how did you find the country and the people here?
Amazing. The experience was amazing. Before even coming, Emmanuel studied here. Emmanuel, the guy who facilitated everything for my coming here. He told me a lot about India.
Yeah.
And one thing he told me was that the India people are very hospitable, and something which I'm a testament to now. So the hospitality was top notch, and the experience was amazing.
Yeah. So Dr. Sallu Alpha came to us and he was admitted, and so 20 days back, and right from the airport from where he was picked up, he was admitted, and within 1 day he underwent a series of tests, right?
Yeah, sure.
So wasn't that quick?
Yes, that was also another very, very good and impressive experience for me. You know, all the tests I did were readily available. Results came out in time, no delays. Everything was
Yeah.
was
So
really
he came on Thursday night. On Friday we did all the tests. On Saturday at 7 a.m. he was posted for surgery, and we were done by 11 a.m.
Yeah, sure.
So Dr. Sallu underwent a keyhole procedure called PCNL, in short, percutaneous nephrolithotomy, along with the DJ stenting, in which a keyhole is made and we remove stones through that. So using a single 1 centimeter scar, he got nearly 4 centimeter of your stones were removed. Yeah. So, and I think you did pretty well by the end of that day, right?
Yeah, sure.
And so, and by then he so that over the weekend he was on various IV antibiotics, and by Monday he was discharged. And then I think you got some time to go around, right?
Yes, we did. In fact, you facilitated that. Our first point, the first time we went around, you facilitated. We went to the riverfront view. And that was also a very amazing experience.
Yeah, because you were caught up in the hospital, and it was a nice change.
Yes, sure.
And also because your brother who was accompanying you also. Who was not a patient, wanted a change.
Exactly.
Great. And wonderful. And finally, I just want you to sum up your experience as a whole in your own words.
Okay. You know, like I stated earlier, my experience was quite amazing. You know, from the reception, the professionalism displayed by the workers, you know, the timeliness with which everything was done, the labs, medications, you know, the care from the staff. It's something I will love to share with anyone who wishes to come to India for medical treatment, because, you know, as a medical doctor back home, I know what these things mean when you have timely intervention. So it's an experience worth it, and I wish to come back here someday, not again as a patient, maybe, but
as a friend,
and maybe to even come and learn so many things to improve on even my own personal and professional development. So everything, this is an experience that was worth it, and like I said, it's something I would love to share with anyone who wishes to come to India for treatment. And Bodyline Hospital is one that I will recommend any day, any time, without any hesitation. You know, back home, most people coming to India, most people like to maybe Delhi, Mumbai, because these are places you don't have to take another flight to come to another city.
Yeah, true.
You know, at some point I also had that thought, so why wouldn't I go to Delhi? Or why would I just stop at Mumbai and find a very nice hospital there? Yeah. But I tell everyone for free and with all honesty and sincerity, there's no regret. I have no regrets coming here. And in fact, the journey from Mumbai to Ahmedabad here at Bodyline Hospital was one that I really enjoyed.
Oh, really?
Because we came with a car. You know, a long journey like that, about 12 hours, you see a lot of things, you experience a lot of things. If it were a flight, then most of those things I saw I wouldn't have seen. Yeah. So I think that's also part of the experience.
So looking back, it was a really wholesome experience.
A wholesome experience.
Great.
It's a wholesome experience indeed.
Thank you. Thank you so much.
What will you say about Dr. Utsav?
Oh, Dr. Utsav, you know, he's an amazing human being. You know, as medical doctors, we have our professional training, how we should interact with patients, what we should do to make patients comfortable. Dr. Utsav went beyond just that. He expressed the humanity in him, not just as a professional, but also as a human being. You know, I came here for a medical treatment, but he made my experience. He made my experience something that I will ever live to remember. And he's one urologist I will always, at any point, recommend to anybody. Dr. Utsav was amazing. He always checked on us. There was no day that Dr. Utsav will not come and check on me. And he does not only come once in a day. He comes in the morning, in the afternoon, and in the evening. And that's something I appreciated the most. And he also had time to explain all my lab results to me, and which is something also that is very good for any patient. Because if patient can just do laboratory investigation without knowing the results or the interpretation of those results, it becomes a problem. But Dr. Utsav had that time to explain. Beyond that, he even had that time to go the extra mile to ask us for the foods we want, and if we say this is what we want to eat, even if the hospital is not available at that moment, he made sure he went beyond his limits to search, and we are able to get it. So, Dr. Utsav, thank you so much. I appreciate you a lot.
Thank you.
From the bottom of my heart, I appreciate you a lot, and may God reward you abundantly for what
Thank you for the kind words, Sallu. And finally, I am so happy that today is the day you are leaving. I am happy because you are cured of your problem, and you go back home healthier, serving the community, and hopefully we meet again as friends, probably outside the hospital.
Yes.
Maybe when I visit your country and you take me around.
Yeah, sure. I'll be happy. I'll be happy to do that. I'll do that happily.
Yeah, and lastly, for positive encouragement, any words, any advice for our wonderful staff?
Like I said, the staff, we are amazing. In fact, one of the staff who impressed me the most, to be very honest, was a guy, I think Sonil, I don't know if that's the name.
Yeah. He's an attendant.
Yes, the attendant who was dedicated to us. You know, that guy, just like you, was very unique in executing his duties. He will be here at all times. Had our time, we spoke, and interestingly, he's one of the very few staff who understood what we spoke, English language a little.
Yeah.
So he was very friendly. He told us about a lot of places. In fact, one of the places we visited, which is Kakaria Lake, he showed us that place.
It was on his recommendation?
Yes, it was on his recommendation that we went to Kakaria Lake.
Oh, wonderful. I didn't know that up till now.
He was the guy. He was so amazing. He will be with us until we are about to sleep. They will say, okay, please just go and have a rest. We also want to sleep now. That was how amazing that guy is. And the other staff, they always check on us. Everything okay? The cleaners will come in maybe every 30 minutes, 45 minutes or 1 hour. They come. Is there anything we need to clean? So it was, you know, those staff, the staff really displayed professionalism, and they really showed diligence and dedication to their duty, which is something I applaud them for, and which also is part of the experiences that made my stay very, very memorable.
Great, thank you. And before we conclude, I would like you to shed some light, because Gujarat, where we live in Ahmedabad, is a predominantly vegetarian state. Yeah. So initially you had some issues, but I think in the last week we could manage some wonderful food for you, and you got some food which was of your taste.
Yeah.
So so do you think that if any other patient comes from your country or from that side of the world, will face any issues related to food?
Yeah, just like many things generally in life, nothing is 100% perfect. So if I can pick out one of my challenges here, is with regards to the food. You know, when we came initially, we had struggle with the foods to eat. You know, just like any other person moving from your home where you have been for the longest of time, going
even within your own country, right?
Yeah, sure.
Yeah.
So that's something that is very obvious, and it's something that is expected. But with time, we are able to get almost all of the foods we wanted. You know, we went to a supermarket where we were able to get things that we looked for, we searched for, and in fact, at some point, I was telling Emmanuel, I said, please, I want to leave now. Try to bring my flight, bring my flight a bit closer so I can leave earlier. He said, no, my man, just be patient. The day we got those foods now wanted, I told my brother, I said, well, we can even extend our stay here now because we have the food we wanted.
Great.
So the foods came in handy at the time we needed it most, and that also was very, very good.
Great. Thank you, Dr. Sallu.
Thank you so
we
much.
wish you the best of health,
Yeah.
and we hope to see you again
Yes.
outside the hospital,
Yeah.
and probably in your country
Yeah.
when we probably make a visit to Freetown.
Yeah, sure.
Great.
Sure.
Thank you so much, and
you.
thank you for doing this interview.
Thank you.
Thank you.